Well, good afternoon, everyone. How are we feeling today? Remember what Lydia said? How are we feeling today? Excellent. So, a few days back, I was driving to work, and I saw a funny accident. And the reason I call it funny is because I saw a scooter trying to tow a car. And the grave mistake that he made was that the rope that he was using to pull the car was quite long. So this gentleman driving onto my right took me over and drove right through the rope. And I saw the scooter driver flying and going onto the other side of the road. So I stopped my car, I got out, I checked on him. He was okay. He was lucky, is what I would say. But as most of us know, not everyone to be in that kind of a situation is lucky. But before we go into all of that and why I'm here, just very quickly, let's try and understand what our world is facing today. We have terror attacks happening across the world, especially in this part of the world. We have train accidents, we have industrial accidents, and of course we have road accidents. So there is a fairly large amount of trauma which is taking place across the country and many parts of the developing world especially, and of course other parts of the world as well. Now, what happens after a bomb blast takes place? What happens immediately after a bomb blast takes place? What happened in Mumbai in July when a bomb blast took place, or in September in Delhi when a bomb blast took place just outside of the Delhi High Court? We see, of course, panic, but we see a large number of people converging on the site and trying to rescue the victims and take them to hospital in whatever way they can. Auto rickshaws, hand carts, trucks, buses, taxis. What happens after a train accident takes place? The entire village, the first people to come to the rescue of train passengers after an accident are the villagers who are around the train tracks. They're the first line of rescue. So you have tractors converging, trucks converging, various kinds of vehicles, and taking the victims to hospital. What happens in a fire or an industrial accident? Very similar. You have a large number of people converging on the site and trying to help those who they can help. Now, that's not the best way to provide trauma care, but that's some line of rescue. What is the only kind of trauma where a victim does not get any care, especially in this part of the world, until the police arrives or until some other official agency arrives? It's a road accident. It's very unfortunate. And what has that led to in our country? By the time this program gets over, about 80 people would have lost their life in road accidents across the country, just in India alone. That's 20 people on an hour, on an average, of course. 20 people dying every hour because of any other public health issue would have become a huge epidemic. Things for media to pick up, things for all of us to be afraid of, and being extremely careful, but unfortunately not in this case. So we have victims who are lying on the road, bleeding. Some are very, very critically injured, some are dead within minutes. But most of them do not get access to any care. So when I used to be, as Lydia mentioned, I was in the corporate sector for quite a while. And I got very moved about this whole issue, and I got exposed to the issue after a personal loss that I faced. But what amazed me most was that, okay, fine, we don't have ambulance services, we don't have a 911 system in India. But what amazed me most is that after an accident would take place, thousands of people, hundreds of people would pass by, would see the victim, but hardly anyone would stop and provide any kind of care or help to someone, especially that injured person. So a couple of months back, again, there was an accident in Delhi, and we saw an ex-Air Force officer lying on the road for 45 minutes. Nobody even cared to call the police. A passing journalist called the police, by which time it was too late. So that became an issue which was, personally to me, extremely unacceptable. That somebody could die on the road in broad daylight in front of hundreds of people while everybody watched. So now how do you deal with such an issue is the first question that came to our mind. So traveled across the country for 8 or 9 months after starting SaveLIFE, didn't know how to deal with the issue, and realized that the solution to India's problem, especially road accident victims, lied not in an ambulance service, but it lay in what we call bystander care. So we started this process of understanding what to do, what not to do, identify a few agencies to work with, and we decided that in order to have the first level of impact, we would work with the police, because at the end of the day, across the country, it is the police that is the first official agency to arrive after an accident takes place. And they are the ones who mostly rush a victim to hospital, even if it's happening after half an hour or 45 minutes. It took us about 6 months to convince the police. I remember my first meeting was filled with jokes being cracked on the mission that I decided to take on, being ridiculed, thrown out of the office, not possible, not happening. It took us a while. We managed to convince the police to work with us, because we told them that you are the first ones on the site. The least you can do is provide basic trauma care or basic assistance to the victim, so that at least the chances of survival after reaching the hospital they can have a fair chance. So they agreed, and over a period of 18 months, we trained about 3,000 police officers in Delhi, only those officers who are on the road, who are most likely to respond to a road accident victim. And then we went to UP, and we're now working in Maharashtra. There are problems in the system, but what's heartening is that we are getting several reports and several case studies of police officers actually ending up saving lives, so much so that last year we had to organize an impromptu but a very large award ceremony for police officers who had made sure that they used the skill that we taught them in and saved the life of a road accident victim primarily, but some other victims as well. But that was not really our end goal. Our end goal was to ensure that people like you and I, when we see an accident happening, can feel free to jump out of our vehicle and help somebody without thinking, oh, I'm going to be harassed by the police, or I'll have to go to the court for the next 20 years as a witness or whatever, so on and so forth. That is one of the primary issues why most people don't get involved, at least in our country, is what my understanding is. So we had to deal with that very important issue. And so we started a policy side of our work, where we went into the details of the criminal procedure code, laws, various things, faced a lot of resistance when we went to the policymakers and said, you need to change this and bring in something that actually encourages people to help. That process is still on. But we couldn't wait. We were in a hurry to do something about the problem. So we said, okay, fine, the immediate solution lies in creating a first responder service which has people from the community who are mobile, who are on bikes or scooters, and we train them to become first responders, especially to road accident victims, but to any other kind of trauma as well. Now, how do you do that? How do you get people to volunteer for something like this? So we came up with a strategy that was very simple. It wasn't really a strategy, it was common sense. It was that since we'd been working with the police for 2 years, and we had helped the police improve their image by saving lives of many, many victims, we told the police that you have police stations across the city. Get us 50 people from each police station area. through your police, the head inspector or the SHO or whatever you call them, so that the people who are being nominated for this job don't have the fear of the police, at least to start with. They feel encouraged. They feel that if the police is nominating us, they would possibly not harass us for something like this. And that would provide us access to the entire city as we go, because police stations are all over the place. So Delhi has 160 police stations. On 26th of May last year, the police commissioner passed an order to all the police stations in Delhi saying that each of the 160 police stations needs to nominate 50 to 75 first responders, people who are living and working in the area, who are willing to do this work, who have bikes, who are mobile, preferably close to pre-identified accident-prone areas, and give them to us. So it took a while, but earlier this year, we finally received a list of 8,200 volunteers from across the city of Delhi who are now going to be trained in basic trauma life support and mobilized. The key word here is mobilized. How do you mobilize people who you've trained? Now, a lot of us have gone through first aid training. I'm sure many people here know CPR. But how do you get to know how to move? How to get to a site? Who would inform them? What to do about that, right? So that is where technology comes in. The idea that I had was that after an accident takes place, there should be some number that people should be able to call. And once they call us and we identify the area of the accident, we should be able to flash a message to all volunteers in that area about that particular accident, let them know about the accident. And even if 2 of them respond, you have some care starting on the site of the accident within minutes while police and ambulance are being informed to get to the scene of the accident. So the earlier thought was we'll send out SMSs. We did some demos. We decided to do this first in a rural area because a majority of accidents are taking place on highways and access to healthcare is many, many hours away. So we picked up a stretch of National Highway 8 where we said we will do this service. We'll find out about 300 to 400 volunteers and test the communication system through them, not through 8,000 people, but through a focus group of 300 to 400 people. And also at the same time create an impact in that specific area. So we realized that SMSs don't work very well in that case. There are some service providers where the messages were reaching after about half an hour of being sent. So we realized that that was not something which we wanted to get into. So thanks to my being from a corporate background and having some connections, I started approaching companies who could develop for us a technology that rather than getting an SMS, people would get an automatic phone call. And once they pick up the phone, there would be a voice on the other side saying that respond if you can, press 1 if you can respond, press 2 if you can't. And at this stage, I'm happy to inform you that we have established a call center, a national call center in Delhi, which can flash voice broadcast messages to our volunteers anywhere in the country and let them know where the accident is taking place so they can respond. The final point that I want to convey is that the cost of implementing this model is less than the cost of purchasing and running 1 ambulance in a year. So that makes the model extremely replicable to the entire country, to rural areas as well as to urban areas. Thank you very much.